Hello everyone and welcome to today's Instagram live session. Today we are going to talk about temporomandibular joint. We'll understand the problems related to temporomandibular joint, what causes these problems, and how can you get benefited through different levels of intervention when it comes to treating a temporomandibular joint. But before that, a warm welcome to all the viewers who are watching us on Instagram, on YouTube, or Facebook. Thank you so much for watching us. And yes, we do this session regularly on Fridays, but we couldn't do this yesterday because considering the lockdown, I was actually at House of Cure, Bandra, and checking out all the patients since we had appointments scheduled, and that's the reason I'm doing this session today. So, friends, talking about temporomandibular joint. Well, it's basically the way your jawbone gets attached to the skull, rest of your head. That is where you call it a temporomandibular joint, and it is just below the ear. So if you just put your fingers around this place and open your mouth, you can feel the joint. So this is one of the ways where in fact you can also check if you have a temporomandibular issue and if it is related to your temporomandibular joint. Now as you can see, the movement of this joint is specifically only opening and closing of the mouth. So any problem related to difficulty in opening or closing of the mouth, or probably in chewing, can be one of the symptoms which could be because of temporomandibular joint. Now understanding how does this symptoms really appear, what all are the symptoms basically. So essentially pain around this area which you could feel, or probably even a little bit of sound while you open and close the mouth, if you can hear this sound all the time, or if you feel that this particular area is a little tender, which means when you're pressing onto it you feel a little bit of pain. Now this means that there could be an involvement of the temporomandibular joint. Popping or clicking in case of temporomandibular joint issues is a very common factor. You can also have toothache or probably even headache. This can actually mimic temporomandibular joint. Sometimes you may get a little confused as to what exactly is the problem, because sometimes even cluster headache or toothache can actually lead to this kind of issues, and you may not be able to understand whether this is because of your headache or whether this is the pain which is coming from the temporomandibular area. So this is all about the symptoms of temporomandibular joint. Now understanding what are the causes of temporomandibular joint. You may be very surprised to know that one of the most important cause of temporomandibular joint is stress, because when we get stressed we tend to clench our teeth. We tend to keep our jaws tightened all the time, and this is one of the reasons where your temporomandibular joint exerts or gets inflamed for any reason, and this can actually start or increase your pain if you have any issues. So thank you so much for joining. We have Abhishek, Vagal, Manish, Jay, Haria, uh, Charismatic, Shrikant. Thank you all of you for joining in. So I was talking to you about the causes of temporomandibular joint, and today we are going to discuss about what exactly are the symptoms, what are the causes, and what are the different levels of treatment that can be done in case of temporomandibular joint. So one of the most important cause, as I told you, is stress. Secondly, it could also be a misalignment of your teeth. If there is any misalignment between your upper and lower jaw, or teeth between your upper and lower area, so there could be temporomandibular joint issues because of that. Then you could also see people who are into eating hard foods, or excessive nuts or very hard foods all the time. They can also contract these kind of issues because of overuse. Essentially you can see that temporomandibular joint issues can be one of the very important common thing. And other things that can mimic temporomandibular issues could be cluster headache, it could be even sinus issues, it could also be the pain around this temple area which you feel, and you may feel that this is actually happening because of the temporomandibular joint. So simple test if you have to do in order to understand if your pain is related to temporomandibular joint or probably it is different from it, is actually keeping your hands just below the ear, this portion. Like you can see, it is exactly near the joint. Okay, so if you keep your hands, rather one finger on both sides, and try to open your mouth this way, and you can either feel pain or you can feel a popping or a clicking sensation. Crepitus is still okay, but if this has to be with some sort of pain, then you need to understand, then this could be a temporomandibular issue. Now, what exactly are the treatment that can be done in temporomandibular joint? Well, standard effect is giving you painkillers, giving you anti-inflammatories, and drugs like that, which actually do not cure your condition but only modify it to some extent or help you relieve the pain for a while. But a better option is actually to consult a dentist who can check you out and who can understand if there is any misalignment of your teeth, and if there are issues where you probably need braces, or probably even something called a bite plate, which actually prevents too much of clenching of your teeth, which happens specifically in the night. Now that's called bruxism, which is again a very common factor which is seen for people who have temporomandibular issues. Now you may be wondering, as a physiotherapist, why am I putting up this topic? Why am I talking about temporomandibular joint when it is a specialty for dentists, or probably someone who has a TMJ specialization? So yes, that's true. A lot of intervention actually happens through drugs, or even for that matter with the super specialized doctors who handle specifically TMJ issues. But recently a lot of techniques with physiotherapy has also seen to give very good results when it comes to temporomandibular issues. However, I will come to this one by one. So starting off, anti-inflammatory and drugs is one of the reasons, one of the causes for one of the places where you can actually have an intervention. Secondly, initial level, a dentist can definitely help you out, but seeing someone who's a TMJ specialist makes more sense, because they are able to understand the problem. They are able to firstly assess exactly the joint issues, the misalignment problems, and accordingly suggest if there are any braces required, suggest if there are any sort of splint required in order to help you out from this whole thing. Thank you everyone for joining in. Bond with you, Deepak Valmiki, Salim Khan, poems by Rakhi, Yoga with Vivek, Abhijit Rohandia, Ravi Chaudhary, Sweetie Nayak, Akshar Ghate, Charismatic Shrikant. Thank you everyone for joining in. It is great to have you all here. We are talking about temporomandibular joint today, and the whole session will be available to you all in a while. I'll be posting the complete video also on our Instagram account. So we were talking about the treatment part. We started with drugs, then coming to seeing a dentist. Secondly, you also need to have a lot of relaxation and stress management techniques, because stress is one of the most important reason where you tend to have temporomandibular joint. If you're constantly thinking and constantly keeping yourself in tension, where your jaws are tight, or you've been clenching your teeth all the time, basically it is an overuse of temporomandibular joint, and this is one area or one aspect of the joint which is actually not really loaded like an ankle joint or a knee joint or a hip joint, which also takes care of the rest of your body. But yes, overuse of this joint, because it is a single hinge, single movement joint where you're doing only a opening and a closing, and whenever you clench your teeth very hard, you actually tend to compress the disc which is within the joint, and that causes a little bit of strain to the joint. So this is all what basically happens so that's why relaxation and stress management techniques is one of the most important thing which can actually help you to cure the temporomandibular joint issues. Now talking about physiotherapy, what role does spinal manipulation or body manipulation has in reference to temporomandibular joint? So it's been almost last 6 months that I have been seeing a lot of TMJ patients, and somehow as I told you that your TMJ problem can also mimic other issues like cluster headache or probably even tinnitus, which is like, you know, having a feeling a sound in the ear all the time, or even vertigo. So these are some of the issues that can actually come together. And now for to handle all these issues, you need cervical manipulations, you need manipulations for your TMJ, which is exclusively done for TMJ patients. And besides manipulation, there are also techniques where we release the soft tissues. So there are about 30 to 40 muscles around this neck area, which are like very simple vertical ribbon like muscles, very thin, but it needs to be relaxed, it needs to be you know, released if there are any soft tissues which are involved. And there is a specific technique to this which is used in physiotherapy. Besides that, dry needling also plays an important role, and we also do a lot of TMJ exercises, which I have recently posted in my video on my YouTube channel, where we have been doing exercises for TMJ patients, and this has certainly shown very good results for our patients. So physiotherapy has all these roles to play. It starts with manipulation of the TMJ joint, which is essentially done after manipulating the cervical and the neck area. So specifically C1, C2 and C3, C4 manipulations have already also helped to reduce your headache. And I have seen a lot of patients. In fact, I've been working closely with a few TMJ specialists, including Dr. Varun Kunte, who's been assessing these patients. And once we have seen these patients after their assessment, after the manipulation session, once we assess them again, we have seen that their the misalignment process has reduced drastically. So this is definitely a very good option. And yes, all of you guys, you can actually put in your questions if you have any, and with the end of the session I will reply to all your questions. So these are basically the different techniques which are used when it comes to physiotherapy in order to treat TMJ pain. Okay, so Suyash is asking me, what is the substitute for Y strap? Uh, so yes, what it's so Y strap is a specific procedure which is used for body manipulation, specifically for the cervical area. But what we are doing is basically we are trying to achieve traction, and this can be done with a different technique also. So essentially, you don't have to use a substitute. You don't have to have a Y strap altogether. The substitute is where you can actually have a cervical manipulation technique, which we normally do with a lot of patients, where because we find Y strap to be a very heavy and a very aggressive kind of technique, and it's not very suggested. But yeah, we have an alternate solution to it, which I use for my body manipulations. Hi, Krutik Partik, Suyash, Rajni Patil, On Ki Fly High, Bond with You, Karma Fit. Thank you all for joining in. And if you have any questions, please put in your questions, and I can have it replied for you. So we can definitely reply to all your questions. And the next session that I'm gonna have in Bandra will be on 23rd of April, where we'll be doing a session. We do understand that we are in lockdown process, and we are taking care of all kind of infrastructure, as well as all kind of regulations that needs to be followed. But yes, it's important for us to see our patients and ensure that we help them out with the pain, and help them out to release their pain, as well as give them some sort of relaxation. And that's the reason I'm committed to see my patients on a regular basis. Yesterday also I was there at Bandra in spite of the lockdown, because we had already scheduled our patients. And I think it's very important that once we have scheduled our patients, we should not take a back step. So 23rd of April, I'll be there again to see all our scheduled patients. And if you are looking for an appointment, well, this is the number: 857 56 857 56 00040. It is 857 56 00040. I have pinned this comment, so you can actually take down this number and you can call out on this number and check for an appointment. Yes, it is always preferable to have your report, Suyash, so we can actually look into it and understand your problem, and based on that plan our therapy. So yes, it is required. So thank you so much for joining in, guys. We are in a lockdown period, and requesting all of you to stay safe, stay healthy, and take care of yourself, take care of your joint, keep moving, and have a nice day. Thank you so much.